Hey there, everyone. Welcome back to the channel. Today, we're diving into a topic that's both fascinating and crucial for public health: the decline in child vaccination rates in Britain. Now, you might be thinking, sure, I've seen those stats, but what's the real reason behind this trend? Well, buckle up because we're about to explore some eye-opening insights and potential solutions. So, let's get started. First things first, let's talk about the context. You've probably heard the stats. Childhood vaccination rates in Britain have been slipping over the last 15 years. The 4-in-1 jab, which protects against polio and tetanus, is now administered to 81% of 5-year-olds, down from 89% in 2014. And the MMR, measles, mumps, and rubella jab, which has been a cornerstone of childhood health, is now given to 84% of kids, down from 88% a decade ago. These numbers are concerning, especially when you consider the impact of vaccines on child mortality rates in Europe, which have plummeted thanks to immunizations. Now you might be wondering, what's the big deal? Well, let me tell you, the decline in vaccination rates has real consequences. Just last year, measles outbreaks hit parts of Birmingham, Bristol, and North London, and 2 children in England have already died from the disease this year. This is a national disgrace, as MPs on the Health Committee put it, and it highlights the urgent need to address this issue. But here's where things get interesting. The rise of misinformation on social media is often blamed for the decline in vaccination rates. However, public health experts argue that while social media plays a role, it's not the primary culprit. Instead, they point to a more mundane but equally significant factor: the decreasing number of face-to-face interactions between parents and medical professionals. Becky Baird, a senior fellow at the King's Fund think tank, explains it this way: despite the colorful media coverage around anti-vaxxers, most parents who turn down vaccination aren't ideologically opposed. It's often a matter of convenience. When parents regularly interact with medics, they're more likely to get their kids vaccinated. But with a 45% decline in health visitors over the last decade, and a struggle to keep up with rising patient demand, these interactions have become rarer. Now, let's talk about a unique solution that's making a difference in Keighley, West Yorkshire. A vaccination clinic set up in a vacant retail unit at a shopping centre has been a game changer. By making the clinic accessible and inviting, they've managed to vaccinate 10 infants in a single morning, including those who were overdue for their jabs. The key? Location and convenience. By setting up shop in a familiar, local venue, they've caught the attention of casual shoppers who might otherwise have missed out. But here's the thing: this model isn't a panacea. While it can help on the margins, experts argue that a bigger, national-level solution is needed. Child poverty, for instance, is a significant driver of vaccine refusal. Parents struggling with bills often don't have the mental bandwidth to think about immunizations. So what's the answer? Some are pushing for a radical approach, making childhood vaccinations opt-out rather than opt-in. In the U.S., states like Texas require certain vaccinations for school attendance, unless parents fill out an exemption form. This approach aims to capture casual refuseniks who aren't opposed to vaccination, but simply don't make the effort. However, experts like Professor Dan Hungerford caution against mandatory vaccination, fearing it could erode trust in healthcare. In the end, the mystery of Britain's vaccination problem persists. Some parents who refuse jabs simply won't say why, and they're often from groups that are hard to reach via surveys. It's a complex issue that requires a nuanced approach. As healthcare professionals, we must continue to engage with these families, address their concerns, and provide them with the information they need to make informed decisions. So, there you have it. The decline in child vaccination rates is a multifaceted issue, and it's up to us to find solutions that work for all families. Thanks for joining me on this journey of discovery. Don't forget to like, share, and subscribe, and stay tuned for more insightful content. Until next time, keep exploring and stay curious.